Module 1, Managing Health and Safety. Health and Safety in Care Training. Welcome to the Health and Safety in Care Training course. Our aim is to broaden your knowledge on the following topics: managing health and safety and risk assessment, food safety, medication safety and hygiene, sleeps, trips, falls and moving and handling, electrical, gas and fire safety and general environmental safety, conflict resolution and health and safety legislation. Topics to be covered. Core elements. Are you doing what you need to do? Delivering effective arrangements. Core elements. To meet legal and ethical requirements, all businesses and organizations, which include residential care homes, must manage health and safety protocols in their facilities. To achieve these, there are 5 core elements which need to be utilized to provide a genuinely safe workplace: legal duties, risk profiling, health and safety management systems, documentation, attitudes and behaviors. Legal duties. Like other departments, health and safety require their own administration and record keeping. It is governed by the Management of Health and Safety at Work Regulations 1999. This means a company must have the following procedures to meet the minimum legal requirements. All care homes also must follow this legislation. If a company employs more than 5 people, there must be a documented health and safety policy for reference. Risk assessments for activities must be prepared and recorded. Risk mitigation plans following the assessment must also be documented. Health and safety information must be freely available to employees. Appropriate supervision must always be in place. Feedback from the workforce should be sought. Instructions and training should be made available to employees where appropriate. Workers should always have access to external health and safety advice or consultancy. Risk profiling. Any competent care home managers will be aware of any natural risks and the chance of unexpected events and accidents that exist in their day-to-day activities. To ensure the well-being of their care work staff, they should compile a workplace profile that will anticipate the cause and effect of each risk. To measure these, a manager should detail the nature and level of risks your organization could face. Note the likelihood of each risk occurring and the disruption it would cause. Record the cost that would be needed to mitigate or stop the risk. How effective an action would be in managing that risk. Health and safety management systems. Formal health and safety management systems are available online for reference and business use. If a manager is having problems deciding how to organize their organization's health and safety protocols, this may provide a useful planned and documented approach. It is entirely the organization's decision as to whether to adopt the examples that can be found. These could include national and international standard plans, for example, quality management system, in-house or tailored management systems, sector-specific frameworks, for example, chemical industries responsible care framework. Documentation. Records and documentation are essential to any organization's health and safety management, from an accident book to fire evacuation instructions. It is important that information is available in physical hard copy or immediately available online for reference, as well as the immediate availability in times of emergency or when reference is needed. It should also be arranged in clear and concise formats. The last thing needed in a crisis is somebody having to wade through many binders to find a medical record for a resident. So, the rule of thumb is that all health and safety information and records are kept in easy to access formats and that an efficient search mechanism is in place. Attitudes and behaviors. Any good health and safety management system is only effective if it is fully adopted and embraced by the workforce. An employer can set rules and standards, but if the employees refuse to act upon them, then they become useless in practice. While this may seem unlikely when discussing the well-being of a collective group of people, it's very easy for staff to become overconfident in their activities and accept unnecessary risks as part of their job. But it doesn't have to be that way. As a good manager and a good level of health and safety standards can be instilled firmly in the organization when the benefits are shown. The main aim is to have a company with an impeccable safety culture where employees work in a risk-free environment. Are you doing what you need to do? If you are in any type of senior role, you should act as a role model and lead by example. Any employee in an organization should consider their behavior and actions when dealing with health and safety management. There are three main factors to consider. These are leading and managing for health and safety, competence, worker consultation and involvement. Leading and managing for health and safety. Part of being a great manager is understanding your responsibilities and how your workforce operates. Therefore, you should ask yourself a number of questions when it comes to your organization's treatment of health and safety requirements. If the answer to these questions is no, you need to be more involved in health and safety management. These are: do you exhibit good health and safety standards and often speak about them? Do you know what risks exist in your organization and is the workforce aware of them all? Are you and fellow managers open to feedback and resulting actions regarding health or safety issues? Do you know how your organization measures and maintains health and safety? Do you know your health and safety representative or champion? Competence. The Management of Health and Safety at Work Regulations 1999 states that it is legally required that an employer appoints a competent person to aid with health and safety management in an organization. By default, this can be an employee, a contractor, or even an external specialist. The most important word here is competent. Questions. In terms of health and safety management, they need to be selected or hired based on the answers to these questions. Are they fully aware of the specific risks that can occur in your organization, and can they sufficiently manage them? Do they know the full range of responsibilities that they cover? Can they be covered in an absence? Do they have the required set of skills, or do they feel a gap in the current knowledge base? Do they have the right qualifications and availability? Can they train others during work time? Do they exhibit the right positive behavior for your safety culture? Answers. If you are satisfied with the answers to those questions, then you will have located a health and safety champion competent enough to help your workforce. In a smaller business, it may well be the manager that will need to take this position. Worker consultation and involvement. To maintain a good health and safety standard, a workforce legally needs to be involved in the distribution of information, the availability of instructions, safety training, and general consultation. It is a good practice for all employees to be involved in some way to improve health and safety management. In that case, the following questions should be considered. Are employees consulted before health and safety changes? Has the workforce size or structure changed recently in any way? Who directs the workforce in an emergency? Does any of the workforce have communication issues? Are there any physically impaired employees that need assistance in an emergency? Is the current level of training satisfactory? When was the last emergency drill actioned? Delivering effective arrangements. As mentioned earlier in this module, a good way to ensure high standards of well-being in an organization is to adopt a formal health and safety management system. However, if you have a reliable and effective system, it may not need to be formalized. This is often known as the plan, do, check, and act approach. Plan. To achieve a high standard of health and safety management, you will need to understand where your organization is now and where you want it to be. In that case, you will need to compile a plan and consider these factors. Record clearly and concisely what you want to achieve, who will take responsibility for it, and how it will be actioned. This will be your policy. Put measurements in place to chart your progress. This can be something as simple as the annual number of accidents in a facility, with a drop in the total pointing to success. Look at fire, flooding, and other possible disaster scenarios. Explore the opportunity to merge emergency procedures with other local organizations. Remember to review and update your policy continually. Do. After planning your actions to improve health and safety, the next step is to put them in place. To achieve these, a manager should take a three-stage approach. Identify all possible risks and detail how you intend to mitigate each one. These should be covered by any previous risk profiling or assessment exercises that have been performed. Organize the activities needed to put your plan into action and ensure that you have the support of the workforce and any other stakeholders. Also, make sure you have the resources to complete the plan. Implement the plan and put all the planned risk mitigation in place. Ensure that appropriate equipment, training, instructions, and supervision is in place. Check. Once a policy has been agreed upon and a plan has been implemented, the results must be monitored to ensure that it positively impacts health and safety standards. To satisfactorily check the results, you should measure and present statistics that prove there has been a hopefully positive change in the workplace environment. You should also ensure that all parts of your plan have been implemented. Evaluate how well risk mitigation measures are working and whether these standards are being followed. Conduct safety audits or exercises if necessary. Perform reviews and investigations on any accidents or near misses that occur in the workplace. Confirm that the plan is making a difference to the environment. Act. With plans and checks in place, you should now be in a good position to review everything that has been applied and what, if any, further improvements can be made. To comply with this final stage, you should review the organization's performance and safety record, which should be improving. If this is not the case, you may need to repeat this cycle and amend your policy or plan. Compare your organization's records and statistics against similar companies and determine if you can learn anything from them. Revisit existing plans and policies to see if updates need to be applied or if amendments are needed. Take action on any suggestions that may arise from any reviews or audits that take place, as well as employee suggestions from feedback. Highlights from this module. Health and safety in care training covers topics like risk assessment, food safety, and conflict resolution. Core elements include legal duties, risk profiling, management systems, documentation, and attitudes. Legal duties involve procedures for health and safety policy, risk assessments, and information availability. Risk profiling includes identifying, measuring, and mitigating natural risks in day-to-day activities. Health and safety management systems offer planned approaches, either standard or tailored. Documentation stresses the importance of clear, accessible records for emergencies and efficiency. Attitudes and behaviors are vital for effective adoption of health and safety standards by the workforce. Leading by example, competence and worker consultation are key factors for senior roles in health and safety. Delivering effective arrangements involves the plan, do, check, and act approach, focusing on planning, implementation, monitoring, and continuous improvement. Thank you. You have reached the end of this module. Hope it was a great learning experience for you. Module 2. Risk Assessment. Risk assessments are very important as they are integral to an occupational health and safety management plan. They help to create awareness of hazards and risks and identify who may be at risk. An effective risk assessment can drastically reduce the likelihood of work-related accidents. In this module, you will learn risk assessment in a care setting. Topics to be covered. Core definitions. 5 steps to risk assessment. Who should carry out risk assessments? Most common risks at care homes. Core definitions. To evaluate risks in an organization, you need to be able to understand the definitions and terminology used in everyday audits and assessments. They are risk. The chance or likelihood that an employee or bystander could be harmed by a hazard that originates from your facility. This could be anything from a scratch to an electrical shock. Hazard: an object, area, task, or substance that has the potential to cause harm to any person. This could be a variety of things, from noxious fumes to sharp objects. Risk assessment: the act of identifying hazards that exist in an organization or facility, followed by a calculation of how likely it is to occur and a plan to prevent harm from coming to any person. 5 steps to risk assessment. There are 5 recognized stages to a good risk assessment. These are: 1. Identifying hazards. 2. Deciding who may be harmed. 3. Evaluating risks. 4. Recording findings. 5. Reviewing and revising. Identifying hazards. The first stage of a risk assessment is to systematically check for all possible hazards that may harm a person. These could be physical, mental, chemical, or biological hazards, and each must be classified appropriately. Physical. These could range from the act of lifting stock, tripping over rubble, constant noise from machinery, dust from storage areas, or sitting in a cramped position for long periods. Mental. These could be attributed to long working periods, antisocial hours, overwhelming responsibilities, work pressure, or corporate bullying. Chemical. This is easily classed as any substance harmful to humans, such as asbestos, acids, or bleaching agents. Biological. This covers infectious ailments and diseases that healthcare staff may encounter, such as tuberculosis and coronavirus. Deciding who may be harmed. The first step in identifying those at risk will realistically start with your organization's full-time and part-time workforce. These should then naturally progress to those who are contractors, visitors, clients, and members of the public on the premises for any reason. Special consideration should be given to more vulnerable people in these fields, such as young people, disabled people, expectant mothers, nighttime workers, customer-facing personnel. Evaluating risks. An employer must determine how probable each danger is to cause harm. Once these hazards have been completely recognized and classified, you can determine whether additional planning is required by determining if the risk is still high, medium, or low in its current state. You can do this by raising the following questions. Are you meeting the minimum legal requirements? Are you following published guidelines? Are you happy with the standard of protection? Can you reduce anything from a high risk to a lower one? Does the workforce have adequate training or instructions to react to a potential hazard? Recording findings. All this information that has been gathered will need to be accurately recorded. Not only does this prove that an accurate and diligent assessment has been carried out, it is essential for use as a basis for the review of working practices. It should be freely available and be treated as a working document. It should never be locked in storage and simply archived for the sake of it. As stated, It is a legal requirement for employers with 5 or more staff to document the main findings of the risk assessment with the details of all hazards noted and the actions taken to reduce or eliminate risk. Reviewing and revising. A risk assessment should be reviewed and revised regularly. While this should be performed at timed intervals, that is, annually, a review should also be prompted when two other circumstances arise. First circumstance. Major changes have occurred in the workplace. These could be prompted by changes in work rotas or employee numbers or the acquisition of new machinery. Second circumstances. Accidents or near misses have occurred recently on the premises. This could either prove that existing health and safety guidelines are working or need to be updated. Either case is a good reason to perform another assessment. Who should carry out risk assessments? Ultimately, the responsibility of choosing who carries out a risk assessment lies with the employer. While there are no specific legal requirements, the following criteria are expected to be satisfied by the person performing the assessment. They have appropriate knowledge of the activity, process, or material that is being assessed. Relevant workers and employees are involved directly and provide accurate information. External contractors and analysts are acceptable if workers and managers remain closely involved. The person is regarded as competent as per the definition. Most common risks at care homes. Care home activities often involve the moving and handling of people, equipment, and stock, along with personal care tasks, medication administration, cleaning, cooking, and many more. Everyone within the care home can be at risk of encountering potential hazards. Moving and handling. Moving and handling is an important component of a care worker's job, which puts them at risk of injury. Many service users require assistance with daily duties, while others are completely reliant on the care professional for their personal care. According to the Health and Safety Executive (HSE), more than a quarter of ill health reports in the social care sector were musculoskeletal, which can be caused by improper moving and handling procedures. Slips, trips, and falls. Many people who live in nursing homes are at risk of falling. The most common dangers include trailing wires from equipment, damp and slippery floors, and impediments, according to the HSE, which were the leading causes of non-fatal injuries in 2019 or 2020. Water-based hazards. These are typically transmitted by breathing in water droplets in the air that contain the germs. This is a risk frequently cited in regard to nursing homes because the elderly are more vulnerable and susceptible to a serious sickness. Hot water and surfaces. Service users with impaired mental capacity or those who are sensitive to heat can be particularly vulnerable to damage from hot water and hot surfaces. Falling and being unable to move away from a hot surface is another significant risk. Fire safety. In the event of a fire, everyone is at risk if there is no safe, regulated environment, qualified employees, proper equipment, or effective safety protocols in place. inadequately trained employees. For all duties within a care home, from physical ones to communication approaches, if care workers are not operating in ways that reflect the 6C's values, they might inflict bodily or emotional harm. Food handling and preparation. Food prepared poorly or with poor hygienic practices might be hazardous to those who consume it. It can also serve as a vehicle for infectious disease transmission. Hazards, infections, and diseases. Failure to follow proper procedures in these situations could result in widespread illness or injury. COVID-19 is the most prominent example, demonstrating that activities must be made to manage, prevent, and control a health and safety concern. Violence and aggression. Many circumstances, such as cognitive impairments like dementia or cultural or linguistic challenges, can raise the likelihood of violence and aggression. It might be directed at personnel or amongst service users themselves. Bed rails. These are not just tools for the job, but also medical devices. Accidents and injuries can occur if they are used incorrectly, and service users can become ensnared. Equipment safety. If the equipment used in the care home is not routinely maintained in accordance with the manufacturer's recommendations and legal requirements, the chance of it failing to function safely and correctly grows. General working environment. The premises and maintenance should be consistently monitored to ensure safe services such as gas, electricity, and water supply. Highlights from this module. Core definitions include understanding risks, hazards, and risk assessment in an organization. The 5 steps to a good risk assessment involve identifying hazards, deciding who may be harmed, evaluating risks, recording findings, and reviewing and revising. Hazard identification covers physical, mental, chemical, and biological aspects. Deciding who may be harmed extends from the workforce to contractors, visitors, clients, and the public. Evaluating risks involves determining the probability of harm and assessing if additional planning is needed. Recording findings is essential, meeting legal requirements and serving as a working document. Regularly reviewing and revising risk assessments is crucial, prompted by changes or recent accidents. Risk assessments should be carried out by competent individuals with appropriate knowledge involving relevant workers. Thank you. You have reached the end of this module. Hope it was a great learning experience for you. Module 3. Reporting of Incidents. Reporting of incidents. Workplace mishaps and near misses can indicate how well health and safety are managed, and recording such instances allows others to learn from them. Certain occurrences must be reported to the proper enforcing authority by law. This module will be helpful in understanding the incident that should be reported and who to provide it to. Topics to be covered. What needs to be reported to the reader? Who should report and how? Should records be kept and can they be shared? What needs to be reported to the reader? Reader. REDOR is a 2013 statutory instrument of the Parliament of the United Kingdom and introduced by the Department of Environment. The reporting of injuries, diseases, and dangerous occurrences regulations, or REDOR, is a regulation that requires employers and anyone in control of work premises to report and preserve records of the following: accidents at work that result in death, accidents at work that result in significant injury, reportable injuries, cases of various industrial disorders that have been diagnosed, some hazardous situations, incidents with the potential to cause harm. Reporting incidents. First type. Any death, whether at work or not, must be reported as soon as possible using the most expedient method. Within 10 days of the accident, a report must be received. Second type. Accidents that result in an employee or self-employed person suffering a specific injury as defined by reader must be notified as soon as possible using the most expedient method. A report must be submitted within 10 days following the accident. Third type. Accidents that cause an employee or self-employed individual to miss work or be unable to perform their regular duties for more than 7 days must be reported within 15 days of the incident. Fourth type. If a person not at work, for example, a patient, resident, etc., is being injured and being brought to a hospital for treatment, it must be notified as soon as possible via any method. A report had to be submitted within 10 days following the accident. If an accident occurs in a hospital and a specific injury is sustained, reporting is the hospital's responsibility. Fifth type. An employee or self-employed individual must report occupational disease diagnoses that are likely to have been caused or exacerbated by their work. Sixth type. Specific risky occurrences as defined by reader that may not result in a reportable injury but have the potential to cause severe harm must be notified as soon as practicable. Within 10 days after the incident, a report must be received. Who should report and how? Responsible persons. The responsible person is responsible for notifying and reporting. This could be the wounded person's employer, a self-employed person, or someone in charge of the premises where work is done. Please read the table given below for more information about reporting incidents. How to report. The employers of agency personnel and contractors who work indirectly for you must report death, specific injury, and injuries lasting more than 7 days. All accidents can be reported online www.hse.gov.uk/readout. However, a phone line is still available for reporting fatal and specific injuries. Please contact the Incident Contact Center at 0845 300 9923. Opening hours Monday to Friday, 8:30 a.m. to 5 p.m. Should records be kept and can they be shared? Every notable incident should be recorded in the incident book. The organization is responsible for recording incidents with specific information, and they should also share that with proper authorities when needed. The record. For 3 years, you must retain a record of each reportable accident, disease, or harmful occurrence. These must include the following: the date and manner of reporting, the event's date, time, and location, personal information on people engaged, a small description of the nature of the incident or disease. Sharing record. You must also keep records of injuries to your employees that last more than 3 days. However, these are not reportable until the employee is out of work for more than 7 days. Safety representatives must have access to appropriate health and safety documents. These includes RIDO records unless they reveal personal health information about individuals. Key points. When it comes to RIDO reporting, there are a few crucial considerations to keep in mind. They are as follows. Do your employees report incidents, including close calls? Is RIDO being used to report all reportable incidents? Do you keep an accident book and a 3-year record of any reportable injury, ailment, or harmful occurrence? Do you examine occurrences in order to learn from them and take appropriate action, such as evaluating risk assessments and safe working procedures? Highlights from this module. RIDO, introduced in 2013, mandates reporting and record-keeping for work-related accidents, diseases, and hazardous occurrences in the UK. Reporting includes deaths, significant injuries, diagnosed industrial disorders, and hazardous situations with potential harm. Incidents involving death must be reported as soon as possible within 10 days using expedient methods. Specific injuries warrant immediate notification with a formal report required within 10 days. Incidents causing more than 7 days of incapacity must be reported within 15 days. Occupational disease diagnosis likely caused by work and specific risky occurrences must be reported promptly. Responsible persons, including employers, self-employed individuals, and premises controllers, are accountable for reporting. Reporting can be done online or by phone, with records to be kept for 3 years, including incident details and personal information. Thank you. You have reached the end of this module. Hope it was a great learning experience for you. Module 4. Food Safety and Hygiene. Managers, chefs, and supervisory staff in kitchens and food preparation areas must be fully acquainted with every aspect of food safety. It is both ethical and legal responsibility towards the consumers of food products. Food must be safe to eat, protected from hazards, and harmless to the consumer. In this module, you will learn about food safety and hygiene. Topics to be covered: roles and responsibilities of a food supervisor, detecting and preventing contamination, food handling risks and practices, spoiled food and its prevention, waste disposal, cleaning and disinfection. Roles and responsibilities of a food supervisor. A supervisor has primary authority over several employees. The role is to ensure staff work professionally and correctly and issue them with their tasks. You will be legally responsible for their actions but won't directly perform catering tasks. Food safety practice. As a food safety supervisor, you will manage the overall food safety practices of a business and need to have an awareness of UK food legislation and standards, understand food safety principles, keep the food safety management system up to date, ensure food handlers work safely and have good personal hygiene. Be available to employees and management during reasonable hours. Identify and prevent food safety hazards. 4 C's of food hygiene. The Food Standards Agency (FSA) publishes the regulations that have the 4 C's of hygiene. These are cleaning, cooking, chilling, and cross-contamination. The 4 C's prevent the most common food safety problems. Cleaning. For cleaning, the necessary steps involve disinfecting equipment, areas and dealing with spillages immediately with cleaning products that meet BSEN standards. Also, don't let waste build up and use an efficient, custom-made cleaning schedule. Cooking. For cooking, standards should include cooking meat until it is piping hot with pink or red meat left inside. Exceptions include steak, adherence to standard cooking temperatures and times, following proper hot holding procedures, and reheating food just once until it is steaming inside. Chilling. Chilling recommendations include always chilling food straight away, frequently checking your fridge's temperatures, keep them below 8 degrees Celsius, and keeping food out of the chiller for no more than 4 hours. Cross-contamination avoidance. Always clean and disinfect work surfaces and equipment after use. Separate areas and equipment for raw and cooked food. Wash your hands thoroughly and frequently and avoid cross-contamination. Keep raw and cooked food separate. Store raw food below cooked food if in the same fridge. Use separate cleaning materials for raw and cooked food areas and equipment. Detecting and preventing contamination. Food can be contaminated at any point between farm and plate during growth, harvesting, storage, transport, cooking, or serving. Contamination can either be from the source or more frequently by cross-contamination. This means the transfer of harmful contaminants, usually bacteria, from one surface or item to another. Detection. If possible, it is better to test food through a third-party accredited laboratory or certification organization. This ensures that food standards are maintained and comply with the law. Food testing laboratories usually test food for pathogens and chemicals. Often this is done according to the most likely risks for any given food type or group. For example, fruits would be tested for pesticides rather than antibiotics, which are more likely to be found in meat. Poultry is routinely examined for bacterial contamination, such as Salmonella or Campylobacter. Prevention. To prevent cross-contamination, you should follow these steps. Thoroughly wash your hands while handling food, particularly in between different tasks. Avoid coughing, sneezing, or touching your hair and wash your hands afterwards. Use separate, clean utensils to prepare different foods. Avoid using the same cutting board and knife for cooked and raw food. Keep cooked food away from raw foods. Cover and store raw foods underneath cooked foods to prevent cross-contamination. Ensure refuse is stored correctly. Clean and sanitize waste bins and refuse areas to prevent pests. Food handling risks and practices. Risks from food handlers can be divided into several categories. Hands. Hands are the most common way of transferring food poisoning bacteria. The human body temperature of 37 degrees Celsius is perfect for bacterial growth. That's why regular hand washing is so important throughout the working day. Face. Many people's habits transfer dirt and bacteria. For example, picking the nose and scratching at nail polish, all are often done absent-mindedly. Prevent these by keeping fingernails clean and short, not wearing nail varnish or false nails, and not biting nails. Cough, sneeze, etc. People with persistent coughs, sneezes, or runny noses must be kept away from food. Saliva particles carry far from a cough or sneeze and contain viruses and bacteria. Eye infractions. Supervisors should keep a watchful eye for infractions and instruct staff accordingly. Smoking. Staff must smoke in designated areas or outside the premises by law. These should be indicated by appropriate signage. Staff must wash their hands after smoking. Flu. As a supervisor, staff must inform you if they are suffering or recently suffered from foodborne illness or flu-like symptoms. Staff must not return to work until 48 hours after they last showed symptoms. Clothing. Appropriate protective clothing must be worn everywhere on the premises. It should cover garments completely. Potential contaminants are often carried on everyday clothes. Spoiled food and its prevention. Spoilage is the cause of most food waste and foodborne illnesses. Spoiled foods can be identified by their smell, appearance, or texture. Common signs of spoilage are slimes, molds, discoloration, bad smells, unusual texture, etc. Prevention. You should always remember that spoiled food must never be sold or served. There are 6 main strategies for preventing food spoilage, which are: food stored at the correct temperatures, food packaging is appropriate and undamaged, food handled hygienically, good personal hygiene, clean workplace, controlled pests. Preservation. There are 6 major methods used to preserve food. Low temperatures. For low temperatures, freezing effectively stops enzyme activity and bacterial growth. For many vegetables with high water content, blanching is necessary beforehand to prevent enzymes from downgrading their quality. Heat. Heat is the main method of destroying food pathogens by fire, hot air, steam, or hot water. Food is then immediately placed in airtight packaging, chilled, frozen, or eaten. Dehydration. Dehydration is the reduction or total removal of food's water content. Common methods are sun drying, using hot or warm air, spray drying, and roller drying. Chemical methods of preservation include salting, nitrates and nitrites, sugar, and pickling or acidification. Physical. Food can be preserved merely by changing its environment or using a physical method of change. Irradiation. It means exposing food to radiation to kill bacteria. Irradiation destroys vitamins but doesn't affect enzymes. Food packaging in the UK must state that the food is irradiated. Waste disposal, cleaning and disinfection. Cleaning, disinfection, and the proper disposal of waste are essential. For these, we use several things. Beans. Let's start with beans. There are two types of beans. Internal waste bins. They must have a lid, be pest-proof, have disposable polythene bin liners inside. External waste bins. They must be waterproof, durable, have securely fitting lids, washed and emptied as part of a schedule. Cleaning and disinfection. Cleaning and disinfection are very much a dispensable part of overall cleanliness. Cleaning and disinfection go hand to hand with waste management. Cleaning. All surfaces and equipment must be cleaned immediately after use. For detergents, they must be available as liquids, foams, gels, or powders, be non-toxic, easy to remove, and should not form scum. Effective cleaning is essential and fulfills legal requirements and reduces overhead costs. Stops contamination and stops pest infestation, prevents the growth of pathogenic microorganisms, removes allergens and physical contaminants, creates a comfortable working environment that boosts morale, promotes a favorable image among customers and rivals, prevents damage to stock and equipment. Disinfection. Cleaning only removes microorganisms. Disinfection kills them. The followings are available. Heat. Heat disinfection is the most effective killer of microorganisms. According to some guidelines, dishwashers should operate at 88 degrees Celsius or more for at least 90 seconds, and sterilizing units should operate at 82 degrees Celsius for at least 30 seconds. Steam. The basic principle of steam sterilization is to expose each item to direct steam contact at the required temperature and pressure for the specified time. Chemicals. Disinfectants by chemical agents which, when applied to the environment, environmental surfaces or animate surfaces, reduce the load of microorganisms, including pathogens, mostly by biocidal effects on various parts of the microbial cellular structure. Irradiation. It means exposing various equipment to radiation to kill microorganisms. Highlights from this module. Supervise and manage employees to ensure professional and correct work. Oversee overall food safety practices, including compliance with UK legislation and standards. Implement the 4 C's of hygiene: cleaning, cooking, chilling, cross-contamination to prevent common food safety issues. Detect and prevent contamination through testing food and following prevention steps. manage risks from food handlers, addressing issues related to hands, face, coughing, sneezing, eye infections, smoking, and flu. Prevent food spoilage through proper storage, packaging, hygiene, workplace cleanliness, and pest control. Preserve food through methods like low temperatures, heat, dehydration, chemical treatments, physical changes, and irradiation. Emphasize waste disposal, cleaning and disinfection, ensuring proper bin usage, cleaning schedules, and effective disinfection methods. Thank you. You've reached the end of this module. Hope it was a great learning experience for you. Module 5, Medication Safety. Medicine is used to care for a patient, manage their diagnosis, prognosis, prevention, treatment, and promote their health. A single medicine error or unsafe medication can wreck a person's life. So, it is important to keep medication safe and aware of hazards. This module will cover the importance of medication safety. Topics to be covered: safe handling of medication, medication and prescription, supply, storage and disposal, safe administration of medication, safe handling of medication. Understanding the medications you administer as a caregiver and communicating properly with your clients are critical stages in managing medication safely. Certain activities may need to be avoided when administering medications in some situations. Principles of safe and appropriate handling of medicines. There are 8 fundamental principles governing the safe and appropriate handling of medications. People who receive social care services have the right to choose their supplier of pharmaceutical care and services, including dispensed medications. Care professionals are aware of each individual's medications, and the social care department has a complete inventory of medications. Care providers that assist clients with their medications are knowledgeable. Medicines are administered safely and correctly, and caregivers respect individuals' dignity and privacy when administering medications. Medicines are available when the individual needs them, and the caregiver ensures that unused medications are safely disposed of. Medicines are securely stored. A pharmacist provides advice to the social care service. Medicines are used to treat or prevent disease, not to punish or control behavior. Medication and side effects. As a caregiver, you must discuss medication side effects with your clients. You should inform them of the following: what potential adverse effects a medicine may have, how common different side effects are with the medication, how serious the side effects may be, which steps they may need to take to reduce or avoid side effects, how long the side effects will last, and if they will improve or worsen over time, what they should do if a certain side effect arises. Responsibilities of care worker. A care worker has certain responsibilities to maintain the safe handling of medication, including assessing what medicinal support a person requires as part of their overall assessment, providing safe care and treatment, including medication administration, administering oral and topical medications under medical supervision, ordering, storing, and disposing of medicines if necessary, ensuring that policies and medication administration processes comply with current legislation and guidance, including supply and ordering, storage, dispensing, preparation, administration, disposal, and record keeping, promoting a culture in which other care providers are encouraged to report incidents, collaborating with other health and social care experts to give the best care possible, making care plan suggestions to family members and health care personnel. Medication and prescription. A prescription is a written order from a doctor to a pharmacist to prepare and administer medicine or remedy. Care home workers. Care home workers should update medication administration records to include accurate information about any changes to medications. Ensure that any change to a prescription or prescription of a new medicine over the phone is supported in writing before the dose is given. Record any modifications to medicines made by remote prescribing in the medicines administration record and the care plan as soon as possible. Include a procedure in the care home medicines policy for tracking the details of text messages received about a resident's medicines and ensuring the resident's confidentiality. Text messages should only be utilized in extreme cases. Who may prescribe? The majority of medicines are prescribed for patients by medical staff who are licensed by the General Medical Council. They must follow applicable legislation, the medicines policy, and professional advice when prescribing. Registered healthcare professionals who have successfully completed an appropriate nationally recognized prescribing course are registered with their professional body as a person qualified to prescribe, and the trust-approved non-medical prescribers may prescribe in accordance with the trust non-medical prescribing policy. Prescribing requirements. When a medicine is prescribed, several legal requirements must be met. The information that must be documented are the name, surname, and initials and address of the person for whom the medicine is prescribed. In the case of children under the age of 12, the individual's age must be specified. Drug name without abbreviation. Dosage. Route of administration typically stated on the manufacturer's product information rather than the prescription. Frequency of administration with minimum dose interval for as necessary preparations. Either the quantity to be supplied or the length of therapy. Name, address, and signature of the prescriber. Date. Supply, storage, and disposal. All medicines given to a patient in a labeled container should have the patient's name, the date and location of issuance, detailed instructions for usage, and the words, keep out of reach and sight of children. Medicine supply. Medicine supply is the process of acquiring medicine to treat a patient. Pharmacies and doctors that give medicines to care home providers should ensure that they have processes in place. Care home providers should identify the best system for supplying medicines for each resident depending on the resident's health and care needs, with the goal of preserving the resident's freedom to the greatest extent possible. They should seek the assistance of health and social care practitioners if necessary. Storage. Care home providers should include the following information in their medication storage process: how and where medicines are stored, including medicines delivered in monitor dosage systems, medicines to be taken and cared for by residents themselves, restricted drugs, refrigerator-stored medicines, skin creams, oral nutritional supplements, and appliances. The temperatures at which medicines should be stored and how the storage conditions should be monitored. Care home providers should assess each resident's requirement for medicine storage and provide storage that suits the resident's needs, preferences, risk assessment, and kind of medication system. Except for medications for emergency use and wound care products, all medicines must be stored in lockable cupboards that meet the current British standards for medicine storage (BS 2881) at a temperature not exceeding 25 degrees Celsius. Refrigerated medications must be kept between 2 to 8 degrees Celsius. In general, vaccines should be stored at temperatures between 2 degrees to 8 degrees Celsius. A mid-range of 5 degrees Celsius is good practice. Disposal. The safe disposal of medicines or pharmaceutical waste is likely to include expired or outdated stock from wards or units, syringes contaminated with remnant medicines from the preparation of medicinal products and pharmaceutical products, and medicines returned by individuals, such as patients' own medicines, that are no longer needed. The situations when medicines might need to be disposed of include when a person's medication is changed or ended, when a person transitions to another care service, when a person passes away, when the medication reaches its expiration date. Safe administration of medication. Safe principles of administration. The process for identifying the correct medicines, making the proper dose, and providing them to the right individual is outlined below. Check that you are providing the medications to the correct person. These may be difficult in care homes. Ask the person if they want their medicines before you take them out of the pack. Assemble a glass of water to swallow the tablets or capsules down. Encourage the person to sit or stand up straight. Use gloves for your own protection as well as to prevent cross-infection when applying medications to the skin. Always keep a record of everything you do at any given time. This includes a record of when the person refuses to take the medication. Rights of medication administration. When administering medicine to patients, we must take precautions to ensure that the drugs are administered correctly. These are sometimes referred to as the 5 R's of medication administration: right patient, right drug, right dose, right route, right time. Highlights from this module: fundamental principles of safe medication handling include client choice of pharmaceutical care, awareness of individual medications, knowledgeable care providers, safe and respectful administration, timely availability of medicines, secure storage, pharmacist guidance, and the use of medications for treatment, not punishment. Caregivers should discuss potential medication side effects with clients, covering the nature, frequency, severity, preventive measures, duration, and appropriate actions if side effects occur. Care workers are responsible for assessing medicinal support, safe administration, ordering, storing, and disposing of medicines while ensuring compliance with legislation and promoting incident reporting and collaboration with healthcare experts. A prescription is a written order from a doctor, and care home workers should maintain accurate medication records, support changes in prescriptions in writing, and include procedures for text message medication information. Medicines prescribed follow legal requirements, including patient details, drug name, dosage, administration route, frequency, quantity or therapy length, prescriber details, and the date. Medicine supply involves processes ensuring proper acquisition for patient treatment, with care providers identifying suitable systems based on residents' health needs. Medication storage should consider where and how medicines are stored, temperature monitoring, personalized storage for residents, and adherence to British standards for medicine storage. Safe disposal of medicines involves situations like medication changes, transitions to other care services, or reaching expiration dates, addressing the need for proper disposal protocols. Safe administration follows the 5 R's principle: right patient, drug, dose, route, and time. Thank you. You've reached the end of this module. Hope it was a great learning experience for you. Module 6: Hazardous Material and Infectious Disease. Dangerous compounds can be found in nursing homes, including pharmaceuticals and medicines, cleaning supplies, disinfectants, and chemical-containing maintenance products. Microorganisms can cause infections and illnesses. In this module, we will learn about the safety of hazardous materials and infectious diseases. Topics to be covered: COSH assessments, specific hazardous substances, infections and diseases, infection prevention and control, medicines and drugs, Legionella. COSH assessments. The Control of Substances Hazardous to Health Regulations 2002 is abbreviated as COSH. In a nursing home, COSH assessments should be quite easy. You should determine the presence of compounds such as cleaning agents, biological dangers, and how they can cause harm. Eliminate toxic substances from your environment whenever possible. Label product with hazard warnings. Ask the supplier or manufacturer for a data sheet if the information isn't readily available. Practice to prevent or control the risk. If it's not possible, PPE should be given. Provide heavy-duty gloves, goggles or face shields, and a well-ventilated location for caustic descalers and oven cleaners. However, toilet cleaning chemicals may merely require rubber gloves. Provide employees with information, guidance, and training on how to safely use and store the product, clean up spills, and properly inspect and wear protective equipment. Provide specialized occupational health guidance to help control the hazards posed to employees by some of the hazardous substances. Specific hazardous substances, infections, and diseases. Skin irritants. Skin problems can be induced by constant contact with soaps and cleansers, as well as wet work. This requires wet hands or hand washing, and as a general rule, employees who wash their hands more than 20 times each day are in danger of acquiring skin disorders. Common skin problems include dermatitis. This is the most prevalent type of work-related skin condition experienced by social care practitioners. Dermatitis is an inflammatory skin disorder induced by contact with foreign substances, which can cause irritation, redness, cracking, and blistering. Urticaria. Contact with something that irritates the skin or triggers an allergic reaction causes this syndrome. Dermatitis is not the same as contact urticaria. Contact urticaria normally emerges soon after skin contact and then vanishes within hours. Urticaria is commonly caused by latex protein in single-use latex gloves, certain meals, for example, potatoes, fish, and meat, and cold or heat. Latex allergies. Proteins found in natural rubber latex, NRL, have the potential to cause dermatitis. Control measures. To manage the risks, you should implement appropriate control measures. Employees should be instructed to avoid direct contact between unprotected hands, substances, products, and wet work wherever possible. Protect their skin because avoiding touch isn't always possible. Examine their hands on a daily basis for the first signs of itchy, dry, or red skin. If they detect a problem, they should consult a doctor or an occupational health service. Gloves. Because of the importance of latex gloves as a source of NRL protein exposure, consider the hazards when selecting gloves. The following is HSE's glove choosing advice, latex or otherwise. Determine whether or not protective gloves are required to complete the task. If protective gloves are required, they must be appropriate for the task at hand. If the assessment determines that latex gloves are the best choice for hazard protection, then latex gloves for single use should be low protein and powder free. People who are allergic to NRL proteins should avoid using latex gloves, whether single-use or reusable. Infection prevention and control. Infection control is a critical aspect of the care home environment. There is a risk of exposure to a variety of human infections which could lead to injury or disease. Control policy. All nursing facilities should have an infection prevention and control policy in place that tackles issues such as employee education and training on infection prevention and control challenges, including outbreaks of infection, hand washing protocols, isolation or placement of service users, aseptic techniques. Good sanitation entails disinfection and decontamination as well as household cleaning, reporting and recording of illness, monitoring, supervision and auditing, prevention of blood-borne virus exposure, including sharps injury prevention and immunization programs for at-risk employees. PPE, including gloves, should be worn. Clinical waste generation, collection and disposal. Risks from blood and body fluids. Employees in nursing homes, particularly nurses, are sometimes exposed to viruses transmitted by blood and body fluids, such as hepatitis B, C, and the human immunodeficiency virus (HIV). General precautions. Covering cuts or grazes with waterproof bandages, excellent personal hygiene, good environmental hygiene, washing and sanitizing contaminated equipment, and using single-use gloves and disposable aprons for high-risk or messy activities are all general measures. Sharps injury. A sharps injury occurs when a needle or a sharp object penetrates the skin. Infection is possible if the sharp is contaminated with blood or other bodily fluids. Sharps injury precaution. If there is a risk of sharps injuries, precautions include avoiding the use of sharps devices wherever feasible, replacing traditional devices with safer sharps devices if replacing them is not possible, making certain that needles are not reheated after usage and are instead discarded directly into a sharps receptacle. Ensuring that appropriate clinical waste disposal procedures, including the usage of sharps containers, are followed. Providing information and education on the safe use of sharps to all employees and workers under your supervision. Providing access to occupational health advice and immunization if needed. Having well-defined protocols in place for dealing with sharps injuries, including quick access to appropriate prophylactic treatments. Hazardous waste. Employees may be required to manage garbage that is potentially dangerous to the handler, residents, and others. The majority of waste in nursing homes is classified as offensive or hygiene waste. Sharp waste. Sharps trash is disposed of in special or hazardous waste streams, depending on the products utilized and their intended use. Hazardous medications will also necessitate specific consideration, and waste pathways may differ within the United Kingdom. Spillage kits. Spillage kits are advised. These should include disposable aprons, single-use gloves, clinical waste bags and tags, paper, towels, sodium hypochlorite, and instructions to ensure personnel follow proper procedures. Containers. Hazardous waste containers should be kept in a secure location until they are removed from the care facility. They should not be permitted to accumulate in hallways or other areas where residents or members of the public can access them. Care provider. The care provider is responsible for the safe disposal of hazardous materials. Transfer notes or other documents can help prove that hazardous material was properly disposed of. Hazardous trash should not be disposed of through the home waste collection service. Medicines and drugs. Certain drugs are hazardous, meaning they pose a considerable risk if they are directly exposed to them in their intact state, crushed or dissolved, or if a capsule is opened. Original requirements. Some medications require special storage conditions to maintain their efficiency and potency. In some circumstances, medicines' expiry dates are shortened if they are removed from their original containers or stored in different temperatures. For example, insulin will last until the manufacturer's expiry date if stored between 2 degrees Celsius and 8 degrees Celsius, but only for 28 to 30 days at room temperature. Secured medicine. Medicines should be stored safely, away from heat, moisture, and light. Seek counsel from a pharmacist on all of these issues and follow their directions to ensure safe drug management and delivery. Furthermore, the patient information pamphlets include storage and management. Hazardous drugs. Hazardous medications such as cytotoxic chemicals used in chemotherapy, certain hormones, and antiviral treatments might induce significant health effects if the person providing the medicine is mistakenly exposed to them. Other drugs and treatments can be hazardous if misused or taken inadvertently. Care home policy. When a care home handles a person's medication, the registered manager or provider is responsible for managing the medications in a safe and acceptable manner. You must have written policies, procedures, and guidelines in place to govern all elements of pharmaceutical handling, and these policies must be monitored and evaluated on a regular basis. Legionella. Legionnaire's disease is a type of pneumonia that can be lethal. In most cases, it is contracted by inhaling many droplets of live Legionella bacteria in the air. Legionella bacteria. Legionella bacteria are common in natural water sources. Outbreaks of illness result from exposure to Legionella growing in purpose-built systems where water is kept at a temperature high enough to encourage growth between 20 to 45 degrees Celsius, and nutrients that support bacterial growth such as rust, sludge, scale, organic matter, and biofilms are present. The bacteria remain inactive below 20 degrees Celsius and cannot thrive over 60 degrees Celsius. The risks. people over 45, smokers, heavy drinkers, people suffering from chronic respiratory or kidney disease, diabetes, lung and heart disease, and anyone with a compromised immune system are at a higher risk. Water temperature. Calorifiers. Hot water storage cylinders should hold water at 60 degrees Celsius or greater. Hot water should be distributed at temperatures of 50 degrees Celsius or greater. Cold water should be kept below 20 degrees Celsius whenever possible. Sentinel points. Sentinel points, which are often the taps furthest and closest to each tank or cylinder, should be identified and monitored for distribution temperatures on a regular basis. Within 1 minute of running the outlet, hot water should reach at least 50 degrees Celsius. Within 2 minutes, cold water should be below 20 degrees Celsius. You should also check the temperatures of the hot water storage cylinders once a month. The temperature of the cold water tank's incoming mains should be tested once a year in the summer. Where hot water circulates, the outgoing temperature should be at least 60 degrees Celsius and the return temperature should be at least 50 degrees Celsius. Keep a note of the checks and temps. Stagnant water prevention. Remove any dead legs or dead ends in the pipes. At least once a week, flush out infrequently used outlets, including shower heads and faucets, or remove where possible. Shower heads and hoses should be cleaned and descaled at least quarterly or as directed by the manufacturer. Checking. Cold water storage tanks should be inspected annually to assess the condition of the inside and outside as well as the water in them and any cleaning or corrective work that is required. To check for debris or symptoms of corrosion, hot water cylinders should be drained. Hot water services should be examined annually. Minimize growth. Where renovations, additions, or new construction are planned, the following guidelines must be adhered to minimize Legionella growth. Pipe work should be as short and direct as practicable. Pipes and tanks should be adequately insulated. Materials that do not promote Legionella growth should be used. Contamination should be avoided, for example, by equipping tanks with lids and bug screens. Highlights from this module. Conduct COSH assessments in nursing homes, focusing on harmful compounds and biological dangers. Eliminate toxic substances when possible and label products with hazard warnings. Provide PPE and training for employees, emphasizing safe use and storage of hazardous substances. Address skin irritants, including dermatitis, urticaria, and latex allergies through control measures. Implement precautions for sharps injuries, including safe disposal and education on sharps usage. Manage hazardous waste, especially sharp waste, with proper disposal procedures and spillage kits. Safely handle medicines, considering hazardous drugs, storage conditions, and expiration dates. Prevent Legionnaire's disease by monitoring water temperatures, identifying sentinel points, and preventing stagnant water. Thank you. You've reached the end of this module. Hope it was a great learning experience for you. Module 7. Moving and Handling. Most care home personnel spend a significant portion of their working day assisting residents. Moving and handling people causes a high amount of injuries to employees. Some people may require support to move about securely and participate in activities, while others may require aid with bathing, dressing, and other tasks. This module will talk about health and safety for moving and handling. Topics to be covered: care home, moving and handling arrangements, moving and handling equipment, training. Care home: lifting, moving, putting down, pushing, dragging, and carrying goods and equipment in laundry, culinary, store cleaning, and maintenance chores are all common in nursing homes. These, too, must be addressed in order to limit the risk of injury and musculoskeletal problems. Poor practice. Poor movement and handling techniques might result in the following: back discomfort and musculoskeletal diseases can lead to disability and the inability to work. Accidents can cause harm to both the staff and the resident being relocated. The resident suffers from discomfort and a lack of dignity. Specialist advice. Moving and handling risks may usually be assessed in-house if employees are qualified to recognize and handle the risks. You may need to seek expert assistance on how to assist some residents who have special moving and handling requirements. Advice sources include occupational and physical therapists, manual handling consultants, and ergonomists with health and social care experience. Professional organizations and bodies such as the National Back Exchange or the Chartered Society of Physiotherapists. Moving and handling arrangements. Several factors must be considered for safer moving and handling. Consider specific residents' requirements as part of the care planning process. Take a balanced approach to manage employee safety while also meeting residents' realistic expectations of autonomy, privacy, and dignity. Things to consider. When considering your overall moving and handling requirements within the care home, keep the following in mind: the variety and frequency with which moving and handling duties are performed, the types and quantities of equipment required for equipment storage and maintenance, personnel necessary for transportation and handling, as well as their competency and training. The surroundings include floors, ramps, illumination, and space constraints, among other things. Moving and handling during crises such as fire evacuations, resident falls, and so forth. Personal assessment. An individual resident's risk assessment and care plan should appropriately cover their mobility and handling needs, both day and night, including what the resident can or cannot do on their own, the amount to which the resident can support their own weight, as well as any other pertinent factors such as pain, impairment, spasm, weariness, tissue viability, or tendency to fall. The resident's ability to participate in or cooperate with transfers. Whether the resident requires assistance to reposition or sit up in their bed or chair, and how this will be accomplished, such as the use of an electric profiling bed. The exact equipment to be utilized, such as the type of bed, bath, and chair, if appropriate, as well as the specific handling equipment, such as the type of hoist and sling size, and attachments to be used. The help required for various types of transfers, including the number of personnel required. Hoisting jobs may necessitate the assistance of more than one individual to ensure the safe transfer. Moving and handling during crises, such as fire evacuations, resident falls, and so forth. Load handling assessment. In a nursing home, there can be major non-people handling risks. Manual handling is common in laundry, cooking, retail, cleaning, and maintenance. You should think about the following: the variety and frequency with which moving and handling duties are performed, the variety of equipment required. The surroundings include floors, ramps, illumination, and space constraints, among other things. Moving and handling personnel are required. Determine methods to limit the risk of damage to the lowest reasonable level possible. This is frequently accomplished through easy and low-cost methods, such as modifying the layout of a store or laundry facility or employing appropriate height trolleys. Moving and handling equipment. Following an assessment, equipment should be introduced and used in conjunction with the care plan and the manufacturer's instructions. Types of equipment. The types and quantity of equipment required will vary depending on the resident's dependency and unique demands. Typical equipment includes a variety of hoists, such as bariatric hoists to lift fallen patients from the floor, standing aids, mobile hoists, bath hoists or lifts, adjustable height baths, and so on. Slings of various sorts and sizes to satisfy the demands of residents. Transfer boards and slide sheets. Lifting cushions and turntables. Electric profiling beds designed for dependent or immobile patients. Support rails or poles, wheelchairs. Weight-bearing occupants will benefit from handling belts, not for lifting. Equipment for emergency evacuation. Walking aids, handrails, and other minor assistance for mobile residents. Use of hoists and slings. The number of hoisting employees required varies depending on the individual resident's needs and the specific hoisting transfers necessary. Some people can utilize a hoist securely without help, while others may require support from workers. Assessments. You should ensure your assessment considers the following: the resident being helped and their requirements, the surroundings and the equipment given, transfers of specific hoisting, how the sling should be used, individuals who are in charge of transferring and handling tasks. An assessment may reveal that at least 2 caregivers are required in some circumstances. One will run the hoist while the other will assist in keeping the individual in a safe position while moving. Problems. During hoisting, safe working procedures must be observed. Failure to comply can lead to serious or tragic accidents. Problems may include failure to choose the correct sort of hoist or sling. These can lead to insufficient support and the risk of falling from the sling. Toileting slings, for example, provide good access but little support. Therefore, their usage should be limited to toileting exclusively. Inability to choose the correct sling size. This might cause discomfort if the sling is too tiny, or it can increase the chance of a person slipping through the sling if it is too large. Employees should be aware that sling sizes and coding vary by manufacturer. Failure to choose the correct loops. Slings may come with a variety of length loops for attaching to the hoist. The length of the attachment controls whether the resident is reclined or upright during the lift. Individuals who choose the wrong loops may find themselves slipping out of the sling. The incompatibility of the hoist and sling results in an unsafe attachment between the two. Always follow the manufacturer's instructions. Concerns concerning the design, supply, instructions or compatibility of a sling or hoist should be directed to the Medicines and Healthcare Products Regulatory Agency, MHRA. Failure to employ a safety harness, belt or attachment where one is provided by the sling. Failure is a result of a lack of maintenance or inspection. Hoist overturn as a result of maneuvering over challenging terrain or failing to follow the manufacturer's operating guidelines. Leaving a vulnerable person unsupervised in a hoist or in a position where they are likely to collapse. Use of electric profiling beds, EPBs. Employees who help residents move in bed can considerably reduce their risk of musculoskeletal problems and back pain by using EPBs. They can also improve users' comfort and independence while lowering the danger of pressure harm. Utilizes of EPBs. Examples of moving and handling duties where EPBs greatly lowered the risk of damage include backrest adjustments, assisting residents in getting out of bed, adjusting the bed height so that workers can offer care, utilize moving and handling equipment at the bedside, and make the bed without stooping or reaching. As the bed can be modified to an appropriate height, assisting the resident in standing up from sitting on it. Training for EPBs. Training in the use of EPBs is required to maximize their benefits. These should include instructions on how to. First instruction. Operate and deactivate the bed controls and determine whether the beds have a battery backup. Second instruction. Keep residents from falling down the bed. Use the knee brace or brake. Third instruction. Adjust the bed height when delivering care or performing tasks. Issues of EPBs. Although EPBs have obvious advantages, you should keep the following points in mind before implementing them. First point. They are substantially heavier than ordinary non-profiling beds and may pose additional risks when moved, particularly on soft floor surfaces or in areas with shallow inclines. Second point. If the bed or other mobile equipment is moved while connected in, the electric cords to the bed may be destroyed. Tripping hazards can also be caused by trailing cables. Third point. Residents and visitors are at risk of becoming entangled in moving pieces. Fourth point. Residents who suffer from mental illness or confusion may be especially vulnerable. Fifth point. Potential control measures include disabling foot controls to prevent the bed from moving if they are accidentally activated, leaving the mattress platform at its lowest setting when immobile residents are unattended, disabling some of the bed controls if necessary. Training. Before performing people handling activities, all staff groups must have appropriate training. This could be part of a broader induction program. Regular refresher and in-service courses are required as part of the training program. These should emphasize health care and injury prevention principles while also promoting the development of handling skills. Content of training. As a minimum, training programs should include the following. All of the work-related risks that contribute to injury. Advice on assessing the environment, task, load, and individual capabilities. The principles of health care and injury prevention as they apply to workplace organization, workplace design, and the use of appropriate equipment. In the workplace, people handling procedures are taught and practiced under supervision, as is the usage of patient handling equipment. Follow-up training and training records. A recall system is required to ensure that all employees, including those who work part-time, have time set out at least once a year for refresher training. The type of refresher training will be determined by what and where people handling is done. Following an injury or event inquiry, more training may be determined as necessary. Train the trainers. A team approach is very crucial for the trainers themselves. Staff that are appropriately qualified and experienced can adjust training to local needs and draw on the knowledge of solutions produced elsewhere within the organization to solve current difficulties. They might also be involved in troubleshooting, which is the process of discovering potential issue areas. Highlights from this module: addressing moving and handling risks in care homes is crucial to limit the risk of injury and musculoskeletal problems. Poor movement and handling techniques can lead to back discomfort, musculoskeletal diseases, accidents, and a lack of dignity for residents. Seek specialist advice from occupational and physical therapists, manual handling consultants, and relevant professional organizations. Safer moving and handling arrangements require a balanced approach considering resident autonomy, privacy, and dignity. Consider factors like the frequency of moving and handling duties, required equipment, personnel competency, and the environment. Personal assessments for residents should cover mobility, weight support, pain, impairment, cooperation with transfers, and specific equipment needs. Load handling assessments in nursing homes involve considerations of duties, equipment, surroundings, and personnel. Introduce and use moving and handling equipment based on assessments, care plans, and manufacturer instructions, including hoists, slings, EPBs, and more. Thank you. You've reached the end of this module. Hope it was a great learning experience for you. Module 8: Safety of Bed Rails. Bed railings, also known as side rails or cot sides, are frequently used in nursing homes to prevent falls off beds. When utilized with the correct bed in the right way for the right resident, they can be a highly successful technique for preventing falls. In this module, we will learn about the safe use of bed rails. Topics to be covered: safety assessment, entrapment, risk of falls. Safety assessment: determine the likelihood of a resident falling out of bed. The evaluation should determine if bed rails are the best way to manage that danger. Poorly fitted bed rails. Asphyxiation occurs when a resident's neck, chest, or limbs become stuck in gaps between the bed rails or between the bed rail and the bed, headboard, or mattress, rolling over the top of the rail, climbing over the rail, climbing over the footboard, violently shaking and dislodging rails, and forceful contact with bed rail elements are all potential hazards. Employees who install bed rails must be aware of the threats and how to assure the resident's safety. The resident's care plan should include information on whether bed rails are used. Intended use of bed rails. When considering the use of bed rails, keep in mind that they are not intended to limit freedom of movement, restrain people, be used as grab handles. Assessment. The points to consider during a risk assessment include the following. Is it possible that the bed user will tumble out of bed? If this is the case, are bed rails a suitable option, or can the risk of falling from a bed be reduced using methods other than bed rails? Could the usage of a bed rail put the occupant's physical or clinical state at risk? Has the bed user ever used bed rails? Do they have a history of falling out of bed or going over bed rails? Do the risks of employing bed rails outweigh the potential benefits? What are the opinions of bed users on the use of bed rails? What bed, mattress, and rail system combinations are being used? Entrapment. Consider the compatibility of the resident bed, mattress, bed rail, and any associated equipment while employing bed rails. Both bed rails should be used to close gaps between the bed and other furniture or the wall, as well as to hold the mattress in place. Entrapment underneath the rail. Causes. If the gap beneath the rail is too great, the occupant may become stuck between the bottom of the rail and the mattress. This could be because of the following factors. Bed rail and bed are incompatible. Combining an airflow mattress with a thin base mattress. Using foundation mattresses that are readily compressed or a mattress that is too tiny for the bed. Solutions. Using an airflow mattress that is more compressible at the edges in conjunction with thinner or easily compressible foundation mattresses may provide access to the gap under the rail. Asphyxiation can occur if you become entrapped under the rail. According to British Standard BSEN 60601-252, 2010, the space between the bottom of the side rail and the mattress platform should be no more than 60 millimeters. When evaluating this gap, consider whether the mattresses are thin and easily compressible at the edge and whether the individual size enhances the risk of sleeping underneath the rails. Entrapment between the end of the rail and the headboard or footboard. Causes. If the rails are not fixed in a safe position, residents can become trapped between the end of the bed rail and the headboard or footboard. Solutions. British Standard BSEN 60601-252, 2010 states the following. The distance between the end of the bed rail and the headboard should not exceed 60 millimeters. To avoid asphyxiation, the distance between the footboard and the end of the bed rail should be 60 millimeters or less or larger than 318 millimeters. When using two-section split rails, the distance between the two pieces should be 60 millimeters or less but not more than 318 millimeters. Entrapment between the rail and the side of the mattress. Causes. Entrapment in the area between the mattress's side and the rail can be caused by a mattress that is too small, insecure fittings, and/or a poorly fitting bed rail system that allows the bed rail to move away from the side of the bed. Only one side of the bed has bed bars, allowing the mattress to move away from it. Solutions. The mattress should fit snugly between both rails so that the occupant's head or torso is not entrapped. You should inspect this gap while keeping in mind the resident's use of the bed rails. If you need further information, contact your bed rail supplier. They should be able to perform the testing outlined in the British Standard. Entrapment between the bed rail bars. Causes. Entrapment can occur if the distance between the end of the bed rail and the headboard is too large. Solutions. Avoid gaps wider than 60 millimeters, as these can induce neck entrapment. Bed rails can be used in conjunction with accessories such as bed rail bumpers or gap fillers. When utilized in conjunction with a properly fitting bed rail, accessories should be strong enough not to be accidentally displaced or readily destroyed. Risk of falls. Falls can happen if a resident climbs or rolls over the railings. The height of a bed rail above the compressed mattress level can prevent an unintentional fall from a bed. The minimum height required by BSEN 60601 252 2010 is 220 millimeters, measured vertically from the top edge of the uncompressed mattress to the top of the bed rail. Causes. Replacing a mattress with one that is substantially thicker than the one suggested by the bed maker, stacking mattresses or utilizing mattress overlays or airflow mattresses may impair the efficiency of the bed rails since the rail's relative height is reduced. This raises the possibility of a person involuntarily rolling or falling over the top of the bed rail. Solutions. According to BSEN 60601 252 2010, a risk assessment should be performed to ensure similar safety when a specialty or mattress overlay is used and the side rail does not exceed the minimum height of 220 millimeters above the mattress. Highlights from this module. Bed rails, also known as side rails or cot sides, are used in nursing homes to prevent falls. Safety assessment is crucial to determine the need for bed rails and potential risks. Poorly fitted bed rails can lead to asphyxiation and other hazards requiring careful installation. Bed rails are not intended to limit movement, restrain people, or be used as grab handles. Entrapment risks involve gaps under the rail, between the rail and mattress, and between rail and furniture. Solutions for entrapment include mattress compatibility, safe distances, and proper fittings. Risk of falls can occur if bed rail height is inadequate, affected by mattress thickness or overlays. Adherence to safety standards like BSEN 60601 252 2010 is essential for effective use of bed rails. Thank you. You've reached the end of this module. Hope it was a great learning experience for you. Module 9. Sleeps, Trips, and Falls. Slips, stumbles, and falls can have a devastating impact on the lives of personnel as well as those receiving care. People who live in nursing homes are more vulnerable to fall injuries. In this module, we will discuss slips, trips, and fall prevention. Topics to be covered. Causes for slips and trips. Controlling the risk. Environmental and organizational factors. Types of fall. Controlling the risks of fall to residents. Controlling the risks of fall to employees. Causes for sleeps and trips. Sleeps and trips can be caused by a variety of circumstances. In different instances, the practical measures required will differ. Some of the most common causes of sleeps and falls are water or other fluids, dry or dusty floor pollution, such as lint or talcum powder, causes slippery surfaces, temporary and permanent impediments, trip hazards, uneven surfaces, and changes in level, such as unmarked ramps, are all potential risks. Inadequate and very poor lighting. Controlling the risk. Slips and falls should be avoided by both residents and personnel. Both should maintain proper control techniques to reduce the risk of slips and falls. Residents. You should identify any persons who are particularly vulnerable and then implement appropriate and necessary control measures. Consider the following factors. Age-related issues. Age-related factors such as declining vision, decreased judgment and memory, changed mobility and increased frailty and reliance can all increase the risk of falling. Falls can occur as a result of weight shifting, trips or stumbles. Medical conditions. Strokes, dementia, fits and faints, low blood pressure, and urinary infections are among illnesses that can increase the risk of falling. Medication. Certain drugs may increase the likelihood of a fall. Older adults may be more sensitive to medications such as psychiatric drugs, sedatives, analgesics, beta blockers, antidepressants, diuretics, and antihypertensive drugs, all of which might cause specific issues. Employees. When considering employee risk, you should examine how work is organized and handled, for example, to avoid hurrying, congestion, and trailing cables. Consult employees on risk control measures, such as selecting the best protective footwear or a planned change in cleaning methods. Environmental and organizational factors. Residents and staff members can slip or trip for various reasons related to trip hazards, such as wet contaminated surfaces. These can be grouped into two factors. Environmental factors. Floors. Slip-resistant flooring should be utilized in restrooms, kitchens, and other areas where surface contamination is difficult to prevent. Stepping from a carpet to a smooth floor, for example, can cause stumbles and slides, especially for persons with impaired vision or movement. Floor levels should be clearly indicated where they vary, and railings should be considered. Contamination. Food, liquids, pee, talcum powder, outdoor leaves and dirt, cleaning agents and other substances can all be contaminated. Design jobs to minimize spills and, if they cannot be avoided, control contamination by containment and cleaning effectively. Obstacles. Floors should be kept clear of trip hazards and obstructions, such as trailing cables, and equipment should be put away rather than left in walkways when not in use. Organizational factors. Cleaning. Determine how, when, and how frequently floors should be cleaned, as well as how spills should be handled swiftly and effectively. Choose the most effective cleaning procedure while avoiding adding new slip and trip hazards. Smooth floors, for example, that have been dampened by a mop are likely to be highly slippery, and access to these places should be restricted until they are dry. Spillages or localized contamination should be cleaned on the spot to prevent the danger of spreading the contamination. Footwear. Consider supplying appropriate footwear for the environment or work activity if your risk assessment indicates a risk of slips and falls. Slip-resistant footwear may be required where flooring is likely to be contaminated. For example, food preparation or wet rooms. Cleaners are frequently exposed to wet flooring, so suitable footwear should be given. Human factors. Having a positive attitude toward health and safety is see it, sort it mentality. For example, dealing with a spillage instead of waiting for someone else to do it helps lower the likelihood of slips and trips. Types of fall. Resident falls from windows, balconies, or staircases can result in serious or fatal injuries and are still a major concern. Falls are classified into three types. Accidental falls. These can happen when a person is sitting on a window sill, leaning out a window, or when the height of the sill or railing is low and works as a pivot, causing them to fall. Residents can misjudge the window heights due to their age. Falls due to mental state. Many recorded incidents involve individuals who are either temporarily or permanently confused mentally, which is frequently caused by senility or dementia, various mental disorder, or alcohol and narcotics, both prescribed and illegal. People can attempt to flee a hazardous area by looking through a window, believing it to be an exit. Deliberate self-harm. This is a known concern for residents suffering from certain mental health issues. These also can be caused by senility, dementia, and many other depressive mental or physical events. Controlling the risks of fall to residents. To appropriately control the risk of residents falling, you must examine the risks posed by the property as well as any additional risks posed by specific inhabitants. Windows. Windows that can be fully opened and are accessible to those who are at risk of falling or climbing out must meet specific requirements. Consider furniture or other items that may allow residents to climb over barriers or access windows when analyzing the dangers. Window restrictor. Where vulnerable residents have access to window openings large enough to fall through and high enough to cause harm, those windows should be controlled adequately to prevent such falls. Window shackles should limit the window opening to 100 millimeters or fewer. Be sufficiently strong to withstand the foreseeable force produced by someone determined to open the window further. Where the casement may distort, restrictors should be installed on both sides of the window. Be strong enough to endure injury. Be securely fastened with tamper-proof fittings so that they cannot be removed or disengaged with easily accessible tools such as cutlery. Window design. The window frames and associated components must be sturdy. The Workplace Health, Safety and Welfare Regulations 1992 approved Code of Practice, Workplace ACOP, and building codes mandate that the bottom edge of opening windows be at least 800 millimeters above floor level unless a barrier to prevent falls is present. Balconies. Where inhabitants are at risk of falling, adequate protection should be installed to prevent them from climbing over balcony edge protection or accessing balconies and external fire stairs. Consider furniture or accessories with footholds that may facilitate access over the rail or barrier. For example, chairs, tables, plant pots, and walls. Stairs. Stairs can be dangerous for anyone, but a number of considerations are especially important for residents and should be factored into the care plan. Stairs should be kept safe, clear of impediments, and adequately lit. If residents have limited mobility and require further assistance, these stairs should have appropriate handrails on both sides. Access to some staircases, such as steep cellar stairs or upper story levels where occupants are at risk of falling, may be restricted. If this has an influence on fire evacuation, consult with a fire safety officer. Controlling the risks of fall to employees. Falling is a great risk to everybody, from staff to residents. Falling from any height can cause harm, especially to older people. We should prioritize fall safety. Precaution. Before operating at a height, follow these basic steps. Avoid working at heights unless it is absolutely necessary. Prevent falls by employing an already safe workplace or the appropriate equipment where work at height cannot be avoided. Reduce the distance and severity of a fall by employing the proper equipment where the danger cannot be eliminated. Safety measures. You should adhere to the following precautionary measures. Do as much as you can from the ground. Ensure that personnel can get to and from their work at height safely. Maintain and examine equipment that is suitable, stable, and strong for the job on a regular basis. Avoid overloading or overreaching when operating at height. Use caution when working on or near delicate surfaces. Provide safety from falling objects. Take into account your emergency evacuation and rescue protocols. Ladder. If a ladder is the proper piece of equipment for these activities, be sure it is the right type and that it has been checked, is in good condition, and is being used safely. When installing safety fixtures and fittings, make sure they are working properly and have not deteriorated due to use, wear, or tampering. Contractors. If you hire a contractor to undertake work at height, you must ensure that they do it safely and do not endanger others, such as by providing safe access and protection from falling objects. Highlights from this module: slips, trips, and falls pose significant risks, especially for vulnerable populations like nursing home residents. Causes include wet surfaces, floor pollution, obstacles, inadequate lighting, and environmental factors. Both residents and employees should implement control techniques to prevent slips and falls. Factors such as age-related issues, medical conditions, and medication can increase the risk for residents. For employees, organizational factors, environmental considerations, and human factors play a role in fall prevention. Falls are categorized into accidental falls, falls due to mental state and deliberate self-harm. Control measures for residents involve addressing risks related to windows, balconies, stairs, and property design. Employee fall prevention includes precautions, safety measures, proper use of equipment, and contractor safety assurance. Thank you. You've reached the end of this module. Hope it was a great learning experience for you. Module 10: Electrical, Gas, and Fire Safety. Electrical, gas, and fire safety is one of the most important things to consider for any kind of residential building. The hazards can range from fire to carbon monoxide poisoning. All of them could be fatal. In this module, we will learn the required electrical, gas, and fire safety. Topics to be covered: electrical safety, gas safety, fire safety, radon. Electrical safety. Many recorded instances have occurred where employees and residents have been fatally injured by badly repaired or maintained electrical circuits. The care home supervisor must make regular checks to ensure that electrical equipment and installations are maintained to prevent any harm from coming to anyone. Electrical maintenance. Equipment used regularly and more likely to be damaged, power tools, kettles, etc., should be checked more frequently, whereas more reliable devices, desktop, PCs, etc., may need fewer visual checks. To do this, you must make sure that for every visible piece of electrical equipment or circuitry, plugs and connectors are not visibly damaged in any way. Stains or burn marks are not noticeable. Cables, wires, and components are professionally repaired and not secured merely with tape. Internal wires are not bare or loose from their holding. Preventing electrical hazards. Main risks. The main risks that run from working with or exposure to electrical equipment are injuries and burns from shocks and electrical arcing, fires from sparking electrical circuitry, explosions caused by sparks igniting flammable gases or substances. Prevention. You should also enforce the following guidelines to prevent accidents from ever occurring. Ensure employees have the training to operate the electrical equipment on site. Ensure that main outlets and sockets are not overloaded with extensions or adapters. Ensure that faulty equipment is visually marked and removed from use. Do not allow the use of outside or third-party equipment until it has been tested and checked. Only allow trained staff to mend or examine circuitry or fuses. Ensure staff have access to electrical planning sites and diagrams. Ensure devices are powered off before any maintenance or checks. Ensure staff follow the company health and safety policy. Portable appliance testing (PAT). Much of the preventative and ongoing maintenance of electrical equipment relies on visual inspection. However, the possibility always exists that an electrical circuit or system may have serious damage that is not immediately visible. Portable appliance testing (PAT), also known as the in-service inspection and testing of electrical equipment, is the recognized solution. The PAT inspection, which must be undertaken by qualified personnel, still performs visual checks, but the equipment will also confirm the following: the correct polarity of supply cables. The fusing is correct and fully active. There is effective termination of cables and cores. The suitability of the equipment for its environment. Gas safety. In any building where gas appliances such as boilers and heaters are in use, they must be properly installed and maintained to ensure there is no danger of fire, explosion, leaks, or carbon monoxide poisoning. This is best accomplished by employing a gas-safe registered engineer or competent person to regularly check their gas appliances and connections. In addition to that, these guidelines should also be followed. Ensure pipework and fuels are maintained, as well as appliances and heating. Make sure that employees are working in well-ventilated areas. Call the National Gas Emergency Service on 0800-111-999 if a leak is suspected and turn off the supply. Fire safety. Fire needs three basic components to ignite and become a hazard: heat, fuel, and an oxidizing agent, usually oxygen. This is known as a fire triangle or combustion triangle. General safety measure. To ensure that employees are protected from harm, employers must perform a fire safety risk assessment and continually review it when changes occur. You should identify the possible sources for ignition or extreme heat, flammable materials, and those it would affect if a fire broke out. You should consider the following safety measures. Keep flammable materials away from heat and ignition sources. Ensure heating equipment is stable, safe, and can't be knocked over by accident. Prevent the buildup of litter and debris that may become a fuel source as it grows. Substances that cause fire and explosion. Premises or facilities that store or use chemicals, vapors, dust, or fibers that are flammable are especially hazardous, as well as obvious materials such as paper and wood. These would include materials such as petrol, engine oil, cellulose, paint and thinning agents, welding gases, food grease and fat, light packaging materials, sawdust, raw amounts of flour or sugar, any type of flammable chemical, fire alarm and firefighting equipment. The care home should continually think of these issues to ensure the well-being of the residents and care workers. Safety measures that should be taken are examining your fire detection system and deciding whether further investment is needed, more fire alarms, smoke alarms, CCTV, room temperature warnings, etc., ensuring that extinguishers and other firefighting equipment are placed correctly and are fully functioning, assuring that relevant staff have been trained in firefighting and have fire marshals posted strategically throughout the infrastructure, reviewing and updating the fire safety policy every time there is a structural or organizational change. Evacuation. The care home must make sure that evacuation instructions are freely available and distributed to all care workers and residents. It should also be made sure that regular fire drills take place and that staff are trained to act in an emergency circumstance with assembly points clear and marked for them. The following guidelines should be enforced. Documentation of how the evacuation alarm is sounded should be considered. Shift workers and casual staff should also be trained for evacuation and those present over a holiday period. The evacuation route must be lit and provide safe transit to the assembly point. Fire exit doors must be clearly labeled and never obstructed, with enough available for the staff on site. Procedures must be in place for physically disabled employees and those who are considered vulnerable. Appointed fire marshals should act as incident coordinators and communicate with emergency services. Radon. What is radon? Radon is a naturally occurring radioactive gas that can seep out of the ground and build up in houses and indoor workplaces located in a radon-affected area. Information on whether your care home is located in a radon-affected area and the degree of likely risk can be found on the UK Radon website. Where does radon concentrate? The highest levels are usually found in underground spaces such as basements. High concentrations can also be found in ground floor buildings because they are usually at a slightly lower pressure than the surrounding atmosphere, allowing radon from the subsoil to enter through cracks and gaps in the floor if appropriate precautions are not taken. Assessment. Radon assessments should be carried out in any building or basement where its location and characteristics suggest that elevated levels may be found and significant exposures to employees and other people are possible. Highlights from this module emphasizes the critical importance of electrical, gas, and fire safety in residential buildings. Covers key topics including electrical safety, gas safety, fire safety, and radon. Highlights the need for regular checks on electrical equipment and installations to prevent harm. Outlines preventative measures for electrical hazards, including training, equipment checks, and avoiding overloads. Discusses portable appliance testing (PAT) as a solution for ongoing electrical equipment maintenance. Stresses the significance of proper installation and maintenance of gas appliances to prevent various hazards. Emphasizes the fire triangle concept and the importance of a fire safety risk assessment. Addresses substances that cause fire and explosion and outlines measures for fire alarm and firefighting equipment, evacuation procedures, and the risks associated with radon. Thank you. You've reached the end of this module. Hope it was a great learning experience for you. Module 11. General Environmental Safety. Care homes strive to make their residents feel at home and welcome. However, they are also workplaces, and while providing a nice atmosphere for residents, providers must also follow employment laws. This module will teach about general environmental safety in and around care homes. Topics to be covered: asbestos, outside areas and vehicle movements, doors and gates, ventilation and heating, display screen equipment (DSE), hot water and surfaces. Asbestos. If you own, manage, or are in charge of a care facility that may contain asbestos, you must consider the dangers of asbestos exposure to staff and residents. It is your responsibility to manage that risk and give information on the location and condition of any asbestos. Asbestos general knowledge. If the building was built or renovated between 1950 and 2000, asbestos is likely to be present, especially if it has a steel frame or boilers with thermal insulation. Owners, managers, and maintenance personnel require the following asbestos information, which should be recorded and immediately accessible. Location. The material types: lagging, ceiling tiles, partition board, etc. Condition. The asbestos types: blue, brown, or white. Condition. Asbestos should be repaired, sealed, encased, or removed. If it is in poor condition or is likely to be damaged or disturbed, you will need to obtain expert guidance from an HSE licensed contractor on the best course of action to take. If the asbestos is in good condition, is unlikely to be damaged, and is unlikely to be worked on, it is safe to keep in place. Otherwise, a management system must be implemented. The management system should check on a regular basis to ensure that the asbestos is accurately labeled, in excellent shape, and has not been damaged. Safety. People who work with or around asbestos are frequently exposed unwittingly. Electricians, plumbers, maintenance staff, etc. Before they can begin work, they must be warned about the existence of asbestos. If you utilize a contractor, make sure you understand their proposed safe method of work so you can be certain that their precautions will sufficiently protect personnel and residents from exposure. Outside areas and vehicle movements. It may be important to determine whether ponds, steps or paths, greenhouses, swimming pools or balconies offer a major risk to vulnerable residents and visitors. Vehicle movement in and around your care home can endanger patients, visitors and personnel. 3 key areas should be considered. Are the outside areas safe? Have you evaluated the safety of vehicle routes and speeds, parking, lighting, delivery site and unloading, visibility and signs, driving surfaces, and people and vehicle separation? Is the vehicle safe? Are your work vehicles, such as those used to transport people, safe for their intended use? Are people safe? Do visitors and contractors follow your procedures, and are staff safe to transport residents? Doors and gates. Doors and gates in regions of the building where occupants have access should be constructed to be easily opened and should not have robust self-closing mechanisms. First example. Some doors, such as those in toilets and bathrooms, may benefit from being rehung to open outwards, as this improves access for emergencies as well as moving and handling. Consider how staff can acquire emergency access to locations where a lone resident may want assistance, such as toilets and restrooms. Such locations may benefit from locks that can be overridden by employees in the event of an emergency. Second example. When your assessment determines that specific residents leaving the premises pose a major risk to their safety, the security of doors and gates should be examined. In some cases, it may be necessary to consider gadgets that alert workers to their whereabouts and whether they are in danger. Ventilation and heating. Workplaces must be properly ventilated with fresh, clean air. However, you must provide a comfortable and appropriate atmosphere for both residents and staff. More fresh air is likely to be required if fumes or hot equipment are present, such as in the laundry or kitchen, to remove fumes and control humidity and temperature. Additional ventilation systems should be installed and maintained as needed. Display screen equipment (DSE). Musculoskeletal diseases such as back discomfort or upper limb illnesses, also known as repetitive strain injury or RSI, visual fatigue and mental stress are the most common dangers associated with working with DSE. You should evaluate and reduce risks at routinely used workstations. Examine the workstation, including equipment, furniture, and the work environment, the type of job being done, and any specific needs of individual employees take efforts to mitigate risks that are discovered. Hot water and surfaces. Care facilities frequently care for residents who may be at risk from hot water or hot surfaces. People in danger include those with impaired mental capacity or temperature sensitivity, as well as those who are unable to react effectively or quickly enough to avert injury. Hot water. Engineering restrictions may be appropriate to guarantee that water is not discharged at temperatures higher than 44 degrees Celsius from accessible outlets where whole body immersion is possible. Domestic electric showers are likely to have temperature control measures. However, water temperatures above 44 degrees Celsius may still occur if flow or pressure fluctuates. If this is the case and vulnerable persons are at risk, more precautions must be taken. Healthcare standard controls and routine safety testing should ensure that the equipment is always safe. Hot surface. Most radiators, accompanying pipes, and radiant electric heaters operate at dangerously high temperatures. Wherever residents live, the maximum accessible surface temperature shall not exceed 43 degrees Celsius. Controls. The danger of burns from hot surfaces can be lowered by doing the following: providing low surface temperature heat emitters, locating heat sources that are out of reach, protecting the hot spots, for example, providing radiator covers. Priority should be given to areas where occupants are most likely to be injured, such as in bedrooms and toilets. Monitoring. Controls must be properly maintained in order to stay effective. Maintenance plans should consider local conditions such as hard water or lime scale, manufacturer instructions, and the risk of valve failure. Employees should be instructed to report any evident flaws immediately and, if required, to close the plant. Highlights from this module. Asbestos poses risks in buildings constructed or renovated between 1950 and 2000, especially those with steel frames or boilers with thermal insulation. Essential asbestos information, including location, material types, condition, and asbestos types, should be recorded and readily accessible. Poor condition asbestos requires repair, sealing, encasing, or removal with guidance from an HSE licensed contractor. Safety measures must be implemented to protect personnel and residents from asbestos exposure, with contractors outlining their proposed safe methods of work. Outside areas, vehicle movements, doors, and gates should be assessed for potential risks to vulnerable residents and visitors. Proper ventilation and heating are crucial in care facilities, especially in areas with fumes or hot equipment. Display screen equipment (DSE) use poses risks like musculoskeletal diseases and mental stress. Regular evaluation and risk reduction are necessary. Hot water and surfaces in care facilities need engineering restrictions and controls to prevent burns, with monitoring and maintenance plans for continued effectiveness. Thank you. You've reached the end of this module. Hope it was a great learning experience for you. Module 12. Conflict Resolution. Residents and workers in a nursing home have the right to expect a safe and secure environment. Violence and aggression are among the leading causes of injuries recorded under RIDOR from the social care industry. These accidents do not necessarily result in injury. However, they are harmful to proper operating order. This module will talk about conflict resolution. Topics to be covered: challenging behavior, the risks, prevention, information and training. Challenging behavior. The personnel should not be expected to accept incidences of violent or aggressive behavior as part of their job. Managers should collaborate with staff and residents to mitigate hazards. Examples of aggression. The following are some examples of aggressive behavior resulting from challenging behavior. A carer is beaten by a resident while providing usual care to that person. An irate visitor who believes their family is being mistreated verbally abuses a manager. A person who refuses to take prescribed medication loudly abuses and threatens a caregiver. A perplexed resident yelled at a contractor who was repairing a piece of machinery. Potential reasons. Residents may not intentionally engage in challenging behavior, and there may be an explanation. The following are some possible explanations for this behavior: medication, impatience, boredom, prolonged waiting or lack of information, anxiety, lack of space or lack of choice, frustration due to problems communicating or boredom, resentment, lack of rights, medical condition which increases aggression or mental instability. The risks. The general risks. The general risks are: the residents, their families, and visitors pose general threats to employees and other residents. The hazards linked with the design of the workplace, for example, blind spots, queuing points. The dangers of homes that give varying degrees of care in different areas or units. The dangers of working alone in the home or when on visits. The risks from individuals. When residents offer a risk of hostility, an individual assessment should be done. It should take into account the following: the resident's mental, emotional, and physical state, the impact of medical issues and the use of drugs, alcohol, or medications on their stress levels, whether they have a history of challenging, violent, or aggressive behavior, as well as probable triggers, whether they regard others as a threat. Prevention. Consider the jobs that people do and how they do them. They should advise the workers on how to avoid such emergencies. Communication. Through effective communication, you can keep cleaners and caterers away from residents who exhibit troublesome behavior. You can adhere to the following guidelines. Give clear directions. Train personnel to operate safely with potentially angry or violent individuals, such as recognizing triggers. Ensure that adequate methods for recording and transmitting information about residents and, when applicable, their relatives are in place. Provide appropriate staffing numbers based on risk. Particular times of the day, such as bathing or feeding times, may present a higher risk of problematic behavior. Have proper plans in place to respond to and document incidents. Manage incoming residents. Ensure you have the correct information about violent behavior at the time of referral and share it with staff as soon as possible. Work environment. To limit the possibility of aggressiveness, make sure the workplace is as safe and secure as feasible. The hazards will vary depending on the services you offer, but you should keep the following in mind. Open expanses and fewer trapping spots provide a good view. Lighting that is diffused and glare-free. Access to parking lots and remote regions. Fixed alarms and personal alarms are examples of security systems. Information and training. All personnel who may be exposed to potentially aggressive individuals should be aware of and understand the preventive actions outlined in their care plans. Providing attention. Staff should be given special consideration when there are new employees or agency workers involved. New residents are being accepted, especially those with a history of challenging behavior. A person's mental or physical status, medicine, behavior, mood, or other factors have changed. Basic training. Training in the prevention and management of violence and aggressiveness can give employees the necessary skills to mitigate or defuse possible incidents. The following should be included in basic training on the principles of managing problematic behavior. The causes of violence. The warning signs. Relevant interpersonal skills, including verbal and nonverbal communication. Techniques for de-escalation. Local working procedures and control mechanisms are described in detail. Procedures for reporting incidents. Specific training. Your risk assessment approach should identify the appropriate degree of training. All employees who may be exposed to problematic behavior should get basic training. However, it is critical to customize the degree and type of training provided to match the individual hazards associated with occupational activities, such as staff caring for residents with minimal risk of hostile behavior may just need basic training. Staff caring for dementia patients may additionally require dementia awareness training as well as basic training. Staff caring for people who are at high risk of physical aggressiveness may require physical intervention skills as well as basic training. Helping after an incident. Gathering staff after an incident can be beneficial for discussing what occurred. This could serve two functions: establishing details of the event and providing emotional help and support. It is occasionally necessary to enhance debriefing with confidential counseling. Highlights from this module: nursing home personnel should not tolerate violent or aggressive behavior and must work collaboratively to mitigate hazards. Examples of aggressive behavior include residents biting caregivers, irate visitors verbally abusing managers, and residents yelling at contractors. Potential reasons for challenging behavior include medication, impatience, anxiety, frustration, resentment, and underlying medical conditions. General risks in a nursing home include threats from residents, their families and visitors, workplace design hazards, varying degrees of care, and risks when working alone. Individual risk assessments should consider the resident's mental, emotional, and physical state, medical issues, history of challenging behavior, and perceived threats. Prevention strategies involve effective communication, clear directions, training on handling potentially aggressive individuals, safe work environments, and proper staffing levels. Information and training are crucial, with all personnel exposed to potential aggression, understanding preventive actions, receiving special consideration during key transitions, and undergoing basic and specific training based on individual risks. Thank you. You've reached the end of this module. Hope it was a great learning experience for you. Module 13: Health and Safety Legislation. There are no particular laws governing health and safety in nursing homes. However, workplace health and safety laws apply to residential care homes. In this module, we will talk about health and safety legislation. Topics to be covered: Health and Safety at Work, etc. Act 1974. Management of Health and Safety at Work Regulations 1999. Other legislation. Health and Safety at Work, etc. Act 1974. The Health and Safety at Work, etc. Act 1974 serves as the foundation for workplace health and safety regulation. It is also known as HAS, AWA, or HSW, and contains most health and safety regulations. The requirements: HASAW is founded on common sense and safe practice. It requires companies to take responsibility for their employees' health and safety at work as far as is reasonably practicable. The responsibilities of the employer. The following are the employer's responsibilities: provide and maintain safe working conditions, provide proper introduction and training in health and safety, maintain and assure the safety of all work equipment, make proper provisions for welfare, make your workplace safe. These cover safe entry and exit. Make certain that all materials are handled, transported, used, and stored safely. Communicate with safety personnel. Provide PPE or any other equipment required for health and safety. Responsibilities of the employers to non-employees. Employers and self-employed people have a general duty under the HSWA to protect the health, safety, and welfare of anyone who may be affected by their business as far as reasonably practicable. Residents in nursing homes, visitors, volunteers, and contractors, staff working on their property are all examples of these. Employees' responsibilities. General duties. Under the HSWA, employees have a general duty to take reasonable care of their own health and safety, as well as the health and safety to those who may be affected by what they do or fail to do, and to collaborate with their employer. Health and safety. They shall not knowingly or carelessly interfere with or misuse anything required by the HSWA for their own residents' or others' health, safety, or welfare, take care of their own health and safety, as well as the health and safety of others, and avoid interfering with any health and safety equipment. Incident occurred. A director, manager, secretary, or another similar health or social care provider officer is subject to prosecution if an offense is committed with their consent or connivance, or if it is committed due to their neglect. Management of Health and Safety at Work Regulations 1999. The Management of Health and Safety at Work Regulations 1999, also known as the Management Regs, require organizations to assess and manage risk. Employers are specially required to undertake the following guidelines. Used risk assessments to manage risk in the workplace. Take steps to mitigate or eliminate risks. Appoint a competent person to monitor workplace health and safety. Provide employees with information and training on safe working procedures. Establish a health and safety policy. Other legislation. There are additional legislations that apply to workplaces. Workplace, Health, Safety and Welfare Regulations 1992. The Manual Handling Operations Regulations 1992 amended 2002. Reader. Kosh 2002. The PPE at Work Regulations 1992. Workplace, Health, Safety and Welfare Regulations 1992. The Workplace, Health, Safety and Welfare Regulations 1992 apply to the vast majority of workplaces. Employers are required to ensure a safe working environment. The regulations address DSE, ventilation and windows, maintenance of equipment, lighting, falling objects, the environment around the working area, waste and facilities such as restrooms, changing room, entry and egress facilities. The Manual Handling Operations Regulations 1992 amended 2002. The Manual Handling Operations Regulations 1992, as revised in 2002, include a wide range of manual handling actions such as lifting, lowering, pushing, pulling, and carrying. Employers' responsibilities. Manual handling is mostly the duty of employers. They should give information and instruction on proper manual handling procedures. Check that the equipment given is appropriate for the purpose for which it is designed. Maintain manual handling equipment properly. Employees' responsibilities. Employees, too, have responsibilities. They should maintain safe work systems, use proper and safe equipment, cooperate with employers on problems of health and safety, inform their employer if they discover any manual handling hazards, make certain they do not endanger others. Reader. Employers are required by reader to record and report workplace incidents and injuries. If the incident is work-related, the law applies where there is a harmful occurrence, injury, accident, or disease. Leading questions. Consider the following factors when determining whether an occurrence is reportable. Was the manner in which work was performed or supervised a factor? Was the accident caused by any machinery or equipment? Are the premises in a bad state of repair? If you answered no to any of the above questions, a report is probably unnecessary. Reportable incidents. Death. All deaths that occur as a result of a work-related accident must be reported. Fractures, amputations, electric shock, crush injuries, burns, and other specific injuries. Non-fatal injuries to members of the general public, non-staff. Accidents involving the general public must be reported if they result in an injury that necessitates rapid medical treatment. A worker is unable to work for more than 3 days. Various occupational diseases and conditions such as RSI and carpal tunnel syndrome. Dangerous incidents. These are close calls. Some incidents, such as the failure or collapse of lifting equipment, must be reported. Koch 2002. The control of substances hazardous to health regulations compel employers to control the use, storage, and transportation of any potentially hazardous substances in order to limit workers' exposure. Hazardous substances. Koch applies to a wide range of potentially dangerous substances such as products containing chemicals, bleach for instance, dust, fumes, vapor, general combustible and asphyxiating gases, various biological agents. Employers' duties. Employers must do the following to limit workers' potential exposure. Determine any use of hazardous compounds. Determine the dangers of utilizing these substances. Reduce or eliminate any identified risk by implementing control measures and verifying that these controls are adequate and effectively implemented. Give instructions and training to the employees and anybody else who may be exposed. Provide monitoring and health surveillance if necessary. Prepare for an emergency. The PPE at Work Regulations 1992. PPE or personal protective equipment is required equipment. Examples of protective equipment include face masks, visors, helmets, goggles, gloves, air protectors, overalls, safety boots, air filters, and hair nets. Additionally, employers must provide PPE equipment at no cost where necessary. Provide instructions and information on how to utilize the PPE equipment correctly. Utilize PPE as a last option when other risk reduction or risk aversion procedures have been implemented. Highlights from this module: the Health and Safety at Work etc. Act 1974 HASAWA serves as the foundation for workplace health and safety regulations, emphasizing common sense and safe practices. Employer responsibilities under HASAWA include providing safe working conditions, proper training, maintaining equipment, ensuring welfare provisions, and making workplaces safe. Employers have a duty to protect the health and safety of non-employees affected by their business, such as residents in nursing homes, visitors, volunteers, and contractor staff. Employees have a general duty to take reasonable care of their own and others' health and safety, as well as collaborate with their employer under HASAWA. The Management of Health and Safety at Work Regulations 1999. Management regs require risk assessment, risk management, appointment of a competent person, and the establishment of a health and safety policy. Additional legislations applicable to workplaces include Workplace Health, Safety and Welfare Regulations 1992, Manual Handling Operations Regulations 1992, amended 2002, REDOR, COSH 2002, and the PPE at Work Regulations 1992. Workplace Health, Safety and Welfare Regulations 1992 address aspects like DSE, ventilation, lighting, maintenance, waste, and facilities. The Manual Handling Operations Regulations 1992, amended 2002, focus on employer responsibilities, including providing proper equipment, and employees' responsibilities, such as maintaining safe work systems. REDOR requires employers to record and report workplace incidents and injuries, including fatalities, specific injuries, non-fatal injuries to the general public, and various occupational diseases. COSH 2002 regulates the control of hazardous substances, and the PPE at Work Regulations 1992 mandate the provision and correct use of personal protective equipment. Thank you. You've reached the end of this module. Hope it was a great learning experience for you.